Okay, we are back and we're going to talk about the breasts now. Okay. Boy, the pictures that I have are, while they are artistic renderings and medical in nature, kind of creepy. So what we're seeing here is a cutaway where we can see the components of the breasts. So the protruding part is called the nipple. The darkened area around the nipple is called I pronounce it areola. I've heard other people call it the areola. Areola? Yeah, I'm not sure which one's the correct one. I call it the areola. And then there is the milk duct. So those little swelling areas that you see, what would be behind the areola, would be the milk duct. And then the milk lobes are those they look like, clusters of grapes, and that's where milk is actually produced. So during nursing, the baby would latch onto the nipple, but what they really do is take the areola into their mouth, and under the areola are those milk ducts. And then the infant would use their lower jaw to work back and forth on that milk duct, and that causes the milk to drop out of the milk lobes and ultimately land in the milk duct and then be emitted out of the nipple. So those are all the structures for producing milk. And then you'll notice in around all of those structures are the yellow globs of fat. So breasts are largely made up of fat with these milk producing components included, right? And then of course you see the muscle layer at the base there, the pectoral muscle. So it's basically just fat with these milk producing structures. And so the size of the breast is determined by how much fat is laid down around those milk producing structures. Those structures are the same regardless if a woman is very flat chested and has very little fat, or if she's very large chested and has lots of fat. It doesn't matter. The milk lobes and the milk ducts, all those things are going to be the same basic size. So a lot of times when women are very flat chested, they think that they probably won't be able to produce enough milk to feed an infant. And it turns out, yeah, they would. The smaller a woman's breasts are naturally, the larger they will seem to get during breastfeeding, because when those milk lobes fill up, they take up a lot of volume. And so for a woman with smaller breasts to start off with, those milk lobes will seem like they really expand out the breast. Whereas a person who has much larger breasts may not notice a significant increase, maybe a cup size, right? But a cup size when you're smaller chested means a lot more than if you're very large chested. So milk making capacity is the same across all women. So there we are with the fat. And I say across all women, of course, there are a lot of factors that help to determine how much milk a woman can produce. And that's usually hormonally based and dietarily based. It's not usually based on the structures being absent or something like that. Now, just FYI, this is not part of our drawing, but usually when breast implants are inserted, they usually are inserted behind the pectoral wall. So milk making capacity would still be present. All right, now I thought I'd make a comparison between the male and the female breast. So on the left is male, on the right is female. And so what you'll notice that's the biggest difference in these two pictures is that yellow layer of, it's nicely labeled adipose tissue on the drawing. But you don't see the same kind of, what they call interlobular. So between the lobes of the milk-making structures, you find this adipose tissue or this fat that in the woman's breast. In the male breast, what you see is what's called fibroadipose tissue. So when there is fat, it's kind of intermingled with, muscle and stuff like that. So it's not quite the same, typically, more pendulous on the female than it would be on the male. You'll notice the nipple is present in the areola, whatever you want to pronounce areola. Those are present on both males and females. And so we've got blind ducts in the male nipple. So they are the beginnings of what would be milk ducts, but they don't typically go anywhere. In the presence of testosterone, those structures that would support milk making capacity deteriorate, and you're left with what we would call the male breast, or probably we would call it, a chest. On females, in the absence of testosterone, the Estrogen causes the pileup of the fat around the lobes and the development of the lobular tissue. In the presence of progesterone, which is the hormone that maintains pregnancies, those lobular tissues grow further and get ready to make milk. And then in the presence of a hormone called prolactin, then they start to produce milk. So, hormone exposure is super important for the development of breasts or the absence of milk-making structures like we see in the male. All right, so now we have two males, and the one on the left has a typically designed, male breast where, the fat's just subcutaneous, and then there's a muscle, and, it just is that. On the right, we have a person who has what's called gynecomastia. And in this condition, you have a male who is experiencing development of their glandular tissue in their breast area. And so it gets squishy and might protrude more, and the nipples may protrude and things like that. So gynecomastia is a condition that affects males and gives them breast tissue. So what would cause that? Well, one really common cause, and a lot of males in the class might be able to relate to this, is just natural hormone changes. First off, at infancy, most baby boys are born with swollen nipples because they've been exposed to female hormones in the womb. Some of those cross the placenta and they experience those in the womb. And so a lot of times baby boys are born with swollen nipples. Baby girls too, but it's less distressing when it's a girl. Then it can happen again at puberty. It doesn't happen to everybody, but for some males, swelling of the breast tissue will occur during puberty. And it's a function of these hormones that are causing these sort of overreactions in the body. And so for some young boys, who are maybe 12, 13, 14, this kind of swelling can be quite embarrassing. They don't want to take their shirts off in front of their peers because they think they're the only ones who have something like this. They think everyone will notice. And so it can be quite embarrassing. But it's really important for me to say it's fairly common at puberty for boys to have this kind of swelling. And then the other thing that can cause, this kind of natural hormone shift would be aging. So men who are over 50 may start to experience symptoms of gynecomastia just as a function of their shifting hormone levels. Then we have some medications that have been shown to cause gynecomastia. Steroids can do that, and steroids are oftentimes prescribed for things other than trying to build muscle, right? You can get steroidal treatments for inflammatory diseases and all sorts of things. So they might be prescribed because the person needs them for some medical condition that they have, and then this is a potential side effect. Anti-anxiety and anti-depression medicines, the SSRIs, have a history of being associated with gynecomastia. So they think that it's possible that these drugs are triggering gynecomastia. Certain antibiotics can cause, temporary bouts of gynecomastia that usually will abate when the antibiotics are stopped. Heart medications can cause gynecomastia. Valium can do it. Hold on, I'm thinking of Ritalin has been accused of doing it. It hasn't. It's not on my list because it hasn't been established at the level that the other medications that I have listed here have been established. There's a class action lawsuit going on right now that has to do with it, but it hasn't been adjudicated, and we're not exactly sure, but it's been accused of it at least. There are some drugs, licit and illicit drugs, that can cause gynecomastia. Marijuana is the number one drug that has been shown to trigger the placement of fat on the chest and on the abdomen a lot more commonly than other parts of the body. So males who use marijuana may find that their nipples are swollen. They may be tender. They might even secrete fluid, milk, basically. So because what marijuana is known to do is act as a precursor to estrogens. And so it can cause the male body to produce its own natural estrogens at a higher level. And so you can get these sort of feminized effects. Heroin and methadone have been linked to it, as well as amphetamines and alcohol. Now, one of the relationships with alcohol is thought to be that alcohol causes people to gain weight, especially around the middle. And so if you have subcutaneous fat around your stomach, that is the exact kind of fat that tends to generate on its own, it generates estrogen. And so if you have a lot of subcutaneous fat on your abdomen, it can trigger estrogen in your bloodstream, which then can trigger the development of gynecomastia. So some things that we consume very voluntarily might be the trigger. And then, I found this picture of Jack Nicholson enjoying a nice, sub sandwich while he's out sailing. And he's got, it could be that he's just experiencing the effects of aging, right? That as we age, that fat gets deposited in different places. It could be that maybe he drinks too much alcohol. I mean, I don't know. It could be that he has a health condition that he might have, one of these things that I've listed here that has been associated with gynecomastia. I'm not trying to cast any aspersions, but people love to take pictures of celebrities and, kind of like, look how they let themselves go. But I mean, with age and other things, a lot of times, natural body changes happen, right? So it could be that what we're looking at in Jack Nicholson is, a side effect of something that he's been using. It could be a symptom of a condition that he has, or it could just be simple aging. Right? It could be just that he's been eating too many sub sandwiches. So lots of different things that can cause gynecomastia, ranging from completely benign, this is normal, you're going to outgrow it, to things that could be kind of, potentially harmful, right? Like this could be a symptom of something bigger going on underneath. And so a person should not just assume that if they're having these kinds of symptoms that it'll go away on its own. They probably should have it checked out. And it's not the most fun to have checked out, because a lot of times if there's development of those breast tissues, the doctor will order a mammogram. And mammograms are really hard when you're flat chested. And so, a male who doesn't have much development of their, mammary tissue, it's going to be difficult, but it's worth it to find out, because men can have breast cancer. And so if there's swelling on a male chest, they need to have it checked out. You need to make sure that it's not a tumor or a harmful tumor. All right. I think that's a good time to take a break. We'll come back in the next bit and we'll talk about the internal structures of the female sexual anatomy.